The healthcare fight continues, as of course we are set to have subsidies expire, and the Democrats have voted against the Senate bills to try to fix our healthcare system. But of course, what we're seeing today is Brandon Gill educating Representative Bell on this exact same topic. But before we begin, don't forget to like, share, comment, subscribe on this video so we can break through the algorithms. Here we go.
So it's befuddling to me when we talk about the ACA, when Republicans talk about how bad the ACA is. First, it's the best thing we got going right now. Yes, it could be improved, so let's improve it. And so let's talk about the history. I'm a data person. So in 2010, Republicans unanimously opposed the Affordable Care Act. We all know that. In 2000, and didn't offer any alternatives, right? No alternatives, just opposed it, every single Republican. They didn't do anything to improve the ACA. So when we are 3 weeks away from the end of the year, in the middle of open enrollment season, and I'm still waiting, we are all still waiting for a vote to protect the American people. So again, I got to ask, where is it? Where is this vote? Where is the help? Where is this plan? Where is the action to back up the promises and talking points? And so where's the evidence that you all truly care about the affordable access to health care for the American people? Because every single thing that we see is just to repeal what has done the best to control costs for Americans. Yes, it could be better, but Republicans got to work with us.
Ms. Tripoli, thank you for being here, and thank you for your testimony. I believe in your testimony you urge policymakers to get to the root causes of high and irrational prices in our healthcare system. Is that correct?
Yes.
And you would agree that healthcare consolidation is one of the main drivers of high prices for patients?
Yes.
I certainly agree. And you also mentioned price disclosure, that hospitals should disclose the rates that they charge openly in dollars and cents, I believe were your words. Is that right?
Absolutely, yes. Price transparency.
I certainly agree. You also mentioned site neutrality, that we ought to prohibit health systems from charging Medicare more for the same procedure if it's done in a hospital versus a doctor's office. Is that right?
Yes.
Well, those are I think are all things that we can agree on, which is really nice to hear. So I appreciate that. Mr. Jacobs, I want to ask you about Obamacare. Obamacare was sold to the American people as a program that would drive down premiums. I think the number that was thrown out by President Obama at the time was $2,500. Has that promise come to fruition?
No, it has not, Congressman. And premiums on individual health insurance policies on the marketplaces and the exchanges more than doubled in the law's first 4 years, and that's primarily because of the regulatory mandates that the law imposed. And premiums have continued to increase substantially, and they continue to increase substantially more so on the exchanges than for employer-sponsored coverage.
So you would say that Obamacare didn't slow the growth of premiums in any meaningful way?
I think, if anything, quite the contrary. I mean, Senator Welch, I believe, last month admitted on the Senate floor that the law failed to reduce costs. But more than that, I think it's accelerated the cost growth because of the consolidation that has come about in terms of hospital mergers, insurers buying PBMs, et cetera, et cetera.
Mm-hmm. And that's what I was getting to. Did Obamacare address or fix any issues related to price transparency?
Ultimately, there have been regulatory efforts. Some of the Trump administration efforts were actually linked to regulatory requirements in the law, but I think we can and should do more. And I think we've also seen that hospitals aren't necessarily complying with that law either willingly or easily.
Did Obamacare address or fix issues related to pricing disclosure?
I think we need to do more, is what I would say.
Got it. And it's your testimony as well, if I heard you correctly, that Obamacare actually exacerbated pricing issues related to healthcare consolidation.
That's correct, and we've seen that in many areas. For instance, the Congressional Budget Office recently released a report on the 340B program and how the 340B program encourages increasing federal spending and consolidation. Now, Obamacare did not create the program, the 340B program, but it certainly dramatically expanded it, and is one of the reasons why it's continues to grow and continues to accelerate health costs.
Got it. And there's with the remaining 30 seconds, As you know, there's a lot of debate right now about potentially extending COVID era enhanced premium tax credits. In your opinion, would that lower overall healthcare costs, or would it raise overall healthcare costs?
The subsidy regime is inherently inflationary because once an individual hits their income in terms of how it's structured in the law, the percentage of income, every marginal dollar of a premium increase gets paid by the federal government. So insurers have no incentive to control costs because whether the premium goes up by 1% or 100%, the feds subsidize that. And so it's an inherently inflationary structure. We've seen the concerns about fraud. I think those reasons, coupled with the fact that enrollments have held steady thus far in open enrollment, all suggest that we should allow the enhanced subsidies to expire.
Got it. Thank you.
So right off the bat, you have Representative Bell saying, hey, Republicans, what have you done to improve Obamacare? Because you tried to repeal it, you tried to rework it. What have you done to improve it? And I would just turn that around and say, hey, Democrats, what have you done to improve it? All you've wanted to do is throw more and more money at this, which of course drives up the price more and more, or you want to make it all single payer. You want to take everybody onto a government plan. So we're going to have healthcare in this country that is just as ineffective as Canada and the UK. And that, of course, is what was all really about in the first place. Obamacare, the ACA, was supposed to be a transition tool to get us into single payer. But we also know that it's not going to work because all you have to do is look at the price increases. Okay, as we can see over here, yeah, here's the increase in price of the Obamacare, the ACA, versus average employer-based individual premium plans. Okay, and as you'll notice, they've gone up twice as much in comparison. Okay, so why in the world would that be? Oh, is it because there is no incentive to be fiscally responsible? Because when you're getting blank checks, as of course is mentioned by the witness there, when the government gives blank checks, there's no incentive to save money. And all that does is jack up prices. But Representative Bell would just simply say, oh, these are some challenges that we have to face. This is the best thing that we have right now. There are no alternatives. Yeah, there are. It's called the private healthcare system. And by the way, Representative Bell also mentioned that Republicans had no alternatives. They had no plan. They were just trying to be obstructionists. Yeah, let's go over here and take a look at what Republicans were proposing all the way back in 2010, 2011. We have state-based insurance markets. Allow individuals to purchase health insurance plans across state lines to increase competition and choice, because we all know the big driver that brings down price is going to be competition and choice. For some reason, we're able to do this with car insurance, but not with health insurance, all right? And of course, if you expand those pools, that could also drive down the price. Tax credits and deductions, offering tax deductions or credits for individuals and families to purchase health insurance rather than relying on the ACA's subsidy structure. Okay, when you subsidize, that drives up price because people get greedy and want to charge more and more for routine services. But if you actually just gave people tax credits or tax deductions, all right, now all of a sudden they have more of their own money and they can use that to buy health insurance. Imagine that. But of course, the Democrats never want to actually decrease taxes on anyone for any purpose. Health savings accounts, hey, expanding those so people can actually save their own money to put into their health savings accounts, so that way they don't have to buy expensive health insurance policies, right? It's the same thing as what poor people and young people and healthy people used to do. They used to buy catastrophic insurance, something that was a lot cheaper because they're going to pay out of pocket or not worry about getting a cold or a sniffle or something like that, right? It's there in case of an emergency. Tort reform, implementing medical malpractice reform to lower costs associated with defensive medicine and litigation, because we all know we're a very litigious nation. So why not protect the doctors who are actually doing their jobs the correct way? All right, let's go ahead and fix that out. Transparency, increasing price transparency in the healthcare market. Can you imagine knowing how much a doctor's visit costs? Can you imagine how much getting a checkup costs? Can you imagine knowing how much your prescriptions cost in advance? All right, it shouldn't be rocket science. It works in every other single industry, but not in the healthcare industry because of the subsidies, because of the insurance, because of the different price schemes people have worked out to hide the cost from the American people. Now, if all of this sounds a little bit familiar, because it's the exact same thing pretty much that the Senate was proposing that the Democrats just went against. So who's actually not trying to fix the system? It's the Democrats. The Republicans have been saying stuff like this for over a decade, and the Democrats still won't listen because it's always the push to single payer. So thank you very much for watching. Don't forget to like, share, comment, subscribe, and say hi to your mom for me. Do you like t-shirts? Of course you do. And now you can support the channel by buying an Angry Teacher t-shirt designed by me, Angry Teacher. So if you like America, if you like freedom, if you like liberty, then go ahead and click the link in the description, where all designs, of course, are 100% mother approved. So enjoy yourself and find something you like today.